Hi everyone, good evening, and thanks very much for joining. My name's Kate Mackenzie, and I'm Knowledge Transfer Manager at AHDB Dairy. And tonight the webinar is going to be on Stop the Spread and Protect the Future. And the presenter this evening is Wendela Wapenaar of Nottingham University. And we're going to be discussing the challenges of biosecurity on farm and how it relates to common production diseases such as IBR, BVD, Neospora and Johne's. We've got about 120 people booked on this evening, so thank you very much for joining. We've got a really good mixture of dairy and beef farmers, also vets and other people from the industry. So it'll be really nice to see what questions and comments come through. So plan for this evening is Wendela is going to run through the presentation for about 30 minutes or so, and then there's going to be plenty of time for comments and questions at the end. Everyone's going to be muted during the webinar, but if you'd like to ask a question, then please type it into the question box, which is just on the little control panel, which is on the right-hand side of your screens. So as we go through, if it's a question that's really relevant to something that we're discussing, then we'll chip in and ask the question. If it's something that maybe needs a little bit more detail, then I might just hold on to it until the end so we can spend a bit more time on it. But I'll be checking these as we go through, so put them in and we'll definitely get round to them at some point. We're also going to do a few poll questions this evening, which everybody can get involved with. So these will come up on the screen and you just select your answers with your mouse just to select which one is most relevant for you. And this will just give us a little bit of feedback on a few different areas that we'd like to hear a bit more about from the audience. So, but we'll make it very clear when we come to these. I'm going to be in the background trying to keep everything as smooth as possible on the technical side. But if we do get any technical difficulties, then just bear with us. But everything should work fine. Don't anticipate anything, but we'll get it sorted as quick as possible if anything does happen. So without further delay, delighted to introduce Wendela. Thank you very much for joining us this evening. I wondered if you might be able to just start us off with a bit of an introduction about yourself, please.
Yes, of course. Thanks, Kate, for the introduction, and thanks everyone for joining. A little bit about myself. So I am Dutch. That's where the accent comes from. I graduated from Utrecht University a little while ago, and I think got interested in biosecurity and still am interested in biosecurity, probably because of the different places where I've worked and the different types of, like, to see how biosecurity is applied in different countries. So I worked in Holland for a little while in mixed practice, then moved to New Zealand, to the Waikato area, where I worked in predominantly dairy practice for 2 years. And then after that, I moved to Canada, to the east coast of Canada, to be precise, Prince Edward Island. For the people that have been there, they know that it's really freezing there in winter, massive temperature differences, particularly compared to what it's like outside here today. Prince Edward Island really relatively famous for lots of really nice Canadian Holstein dairy cows that they've got over there. I did my residency there, I did my PhD there as well, and then moved to a different island, which was the UK. Worked in practice here for a little bit, and soon got interested in building this new vet school in Nottingham. So that's where I started in 2007, which is quite a while ago already, and quite enjoying teaching students right from year 1 all the way up to year 5. And as you can imagine, we talk to them a lot about biosecurity as well, because it's quite a important topic, I would say. So that's a little bit, or I guess enough about myself. What I would really like to do in the next 30 minutes is talk a little bit about biosecurity, and then as applied as possible, because I can show you, and I will show you in a minute, a list of things that we all need to do with regards to biosecurity on farms. But I think the reality is that lots of us know all the different things that we could do, but I think what we're struggling with is sometimes to prioritize, to figure out what is really important on a particular farm, and that's directed as vets as well as farmers. So what I'm hoping is, with these couple of slides that I've got to show you, and with a couple of questions that we'll ask you as well, to get a little bit of insight in why I guess biosecurity sometimes is more complex than we would like it to be. And just to make sure that we're all talking about the same thing, so if I talk about biosecurity, I'm thinking of ways, preventive measures predominantly, that we can use to reduce the spread of disease. And you've got some happy, smiley students here. So this is our year of 3 students that are practicing their rectal cows for the first time, for some of them, I guess, for the first time in their life. And you can imagine that. So we go on to a normal commercial farm for this, and we obviously talk to them about biosecurity and try to get onto the farm as clean as possible and try to leave the farm as clean as possible. And everyone quite sees that as, oh yeah, that's biosecurity, that's really obvious. But if we actually thinking about some of the other things with regards to biosecurity that are important, there's a lot more than just wearing clean wellies and dipping our boots and all that sort of stuff. And before I want to move in to talk about a little bit more about that list of things, I'd like to ask you a question, and I'm hoping that Kate can put this question up with regards to the options. So the question is, in general, what is the most important risk factor that we need to consider when we're aiming to improve biosecurity on farm?
Yep, that's up now. So we've had quite a few votes already. Just waiting for a few more to come in. We've had about 50% voted now, so you just click on the one that applies to you the most. You can select more than one if you have 2 that are particularly of concern, but just the one that's most would be best. Okay, we're just at 60% now. Right, we'll close it there because it might not be relevant for everybody. Just a second. Okay, can you see those results okay?
No, so I can't see the results now. So if you can talk me through that, or point out to me how I can see them, because I'm still just looking at my slide that hasn't got the question on that. Sorry.
Okay, sorry. Right, okay, so we've got Neospora at 60%, IBR at 13, BVD 53, and then Youngish at 47. So we've had people select more than one. So Neospora came out the top, and then BVD and Youngish pretty similar, and then IBR probably the least.
Yeah, okay. Sorry, that's the wrong answers with that particular question. Okay. Oh, this might be challenging to get these questions right. So this was really about risk factors and not about the specific diseases. So the answers that you have there, Kate, go with that question 3.
Hang on, sorry. Right, there we go. Sorry, everyone. Let's get the right question. So the risk factors.
So it should be the risk factors. So the first option should be introducing new cattle. Second option would be decreased immune status of animals on the farm.
Yeah, that's great. That's up there now. Sorry about that.
Yeah, see, and I can't work out why I can't see those options, but it's all right if you can see them on there, and
I know.
Yeah,
usually people can. So sorry about that. I'll try and read them to you as easily as I can.
Yeah.
Right, we've had about 60% now.
Yeah.
Okie doke. Right, I'm just going to close that then and share the results for people. So, Ben, I know you can't see it, but the biggest one at 72% was introducing new cattle.
Yeah.
And then visitors was second at about 17%. And then it was equal for the middle 2 at 6%.
Yeah. Perfect. Okay. Excellent, because that's really nice, because that hopefully, so I'm going to move on to my next slide then, because that's definitely the answer that I would have given as well, right? So introducing new cattle or introducing anything onto the farm with regards to the same species. So if you've got cows on your farm, it's bringing other cows on the farm. That's by far the biggest risk factor overall. So, and that takes me to this next slide. So that's really the point that I want to try to get across, because some people would say, oh, well, okay, so there's lots of the things with regards to biosecurity that you can do. What is the most important? Is there anything that's non-negotiable? And I would argue having a closed herd is really the top one. That's why it's in there in bold. Now, I know that's often easy to say, but it's not always possible, right? So therefore, lots of the other things come in. So yeah, you need to think about buying in, and if you're buying in, what do you know about the herd status? What do you know about the animal status? And I've put the link to the bovine TB hub there, so you can actually see which farms have which status for bovine TB. There's something around herd health plans that you can think about. What do you know about your farm, or what do you know about the farm that you're buying from? And then there's things around boundaries, and there's lots of things on this list that you can think about with regards to biosecurity. All the other things here are not in order of importance. So with regards to the question I asked, it's difficult to say that concurrent diseases is a bigger risk factor than visitors, for example, because we don't really have that evidence. But what we do have the evidence for is that introducing new cattle is really one of the biggest risks for the majority of diseases that we're dealing with. But I don't need to dwell on that too long, because lots of you gave that right answer. So let's not talk about that for too long. What I would really like to do next is I would sort of like to move on and use this slide with all those different items with regards to biosecurity measures that we could do, and then apply those to Neospora in this case. And that's how I would sort of like to set up probably the next 15 minutes or so. So talk a little bit around Neospora, talk about the biosecurity measures that you can do to limit or control Neospora, and then go back to this slide and then reflect a little bit on which are the bits and pieces that we actually can apply for that specific disease. And then we'll talk about the 3 other diseases, so IBR, BVD, and Youngish disease, much shorter, because I don't want to hold everyone up for longer than half an hour, but sort of pick some of the key points that are really relevant for those specific diseases. So that's what I would like to do for the next 20 minutes or so. So let's move on to that slide of the Neospora life cycle. So this is I think it's quite a nice slide that's been done by Milton McAllister, who used to work at the University of Illinois, is in Australia now, and has done lots of work on Neospora. Excellent researcher, really. And I think the slide that he put together is really helpful to sort of talk about Neospora and how Neospora works. And it's not that I want to make you a parasitologist, but I would really like to use that to sort of explain, or sort of try to explain why certain things work and why other things don't work with regards to biosecurity measures that you might find in lots of the lists on the internet. If you would Google for biosecurity, you could get a whole raft of different things. Now, let's think about Neospora for a bit, and then let's see what works and what doesn't work to control it. So if we start with the cow, that's probably the easiest. So if we start here with the cow at the bottom on the right, that cow can get infected with Neospora because she's eating oocysts that are passed in the feces of dogs or other wild canids. Now, the other wild canids drawn up here, you've got the coyote. The dingo is a confirmed definitive host as well as the domestic dog. And then there is some evidence, but not conclusive evidence, that foxes are involved as well. But for a matter of practicality, or if you would ask me my opinion, I would include the fox in that list, even though the evidence is not 100%, it is pretty close. So coyotes, dingoes, foxes, dogs, if they poo and they are infected with Neospora, if that poo gets eaten by cows because it's, for example, mixed in their TMR ration, that's how cows can get infected. If we then think about this part of the cycle, so on the right-hand side, which is what we would call the horizontal transmission cycle, that dog gets infected with Neospora because it's been eating an infected carcass or placenta that's infected with Neospora as well. And there's 2 ways that it can get access to that. And the way that we know for many years, what is it, since 87 or so already, is that dog can get infected by eating an aborted calf or the placenta of a cow that's infected with Neospora when she gives birth to a Neospora infected calf. But what we know more and more of, and some of that is very recent and lots of that we already know for around 10 years or so, is that there's many more intermediate hosts that sort of act like a cow. So if deer, but also rodents and pigeons, chickens, lots of other wildlife can get infected with Neospora as well. If those animals are eaten by the dog can actually get infected with Neospora via that wildlife and then pass oocysts in the feces. Right, so that's how the wildlife part fits in the Neospora life cycle. So that's what we would call horizontal transmission. So that's where always a canid, a dog or a fox for the UK, needs to be involved. Now, then we need to think a little bit about this vertical propagation cycle. So that's the bit that you see at the bottom of that picture. And that's because that parasite is pretty clever. So what the parasite does is when the cow ingests that oocyst, the cow doesn't get bothered by it at all. Like the cow doesn't get ill, but what the parasite does is it transmits through the placenta to the fetus, and then three things can happen. The majority of the time that parasite will actually infect the calf inside the uterus, but that calf will be born perfectly healthy but infected with Neospora. So that would be a calf with a persistent infection. Lots of the times, or not lots of the times, but that's fairly frequent, that calf will abort, or the cow will abort that calf if that parasite passes the placenta, and particularly she will abort around 5 to 7 months in gestation, which are the really annoying ones, because those are fairly sized calves that cow then unfortunately aborts. And then the third option is what you see at the bottom here, is a birth of a healthy uninfected calf. Now that's relatively unlikely. So, or she aborts, or she produces an infected calf, and sometimes she produces an uninfected calf. Now, if we know that this happens fairly frequently, then you can also imagine that that vertical transmission can just keep going generation after generation. Because if that cow produces a persistently infected calf, and that calf grows up to a heifer, you breed that heifer, then it's quite likely that she will again transmit that parasite to her fetus, and then the same options can occur, right? So that's what we would call vertical transmission, so through the placenta to the calf. Now there's more and more information, and again that's fairly recent, is that the efficiency of that vertical transmission is actually quite variable. So that ranges somewhere between 30 and 100%. So that means if you have as a simple example, if you would have a herd of, let's say, 10 cows, and all of your 10 cows would be Neospora positive on the test, so they would all be infected with Neospora, with the Neospora parasite. If you would be the herd with 100% vertical transmission, then all those calves coming from those 10 cows will be Neospora positive. If you would be the herd with the only 30% transmission, that would mean that only 3 of your 7 calves being born out of Neospora positive animals will be Neospora positive, right? And that's important to think about, because we've been trying, or the researchers have been trying to work out what makes that difference. And we don't really know it clearly yet, but it definitely has something to do with the immune status of the animal at the time of pregnancy, and how likely it will be that she will then pass on that parasite. So if her immune status is really good, she might be able to prevent that parasite from entering the placenta and therefore infecting the fetus. So that would reduce vertical transmission. Right, so that's my bit about the life cycle. What I would like to do next is then move on and to sort of think about the ways that we can control it. And I'll probably give you a bit more information and a bit more detail with regards to the epidemiology, or how the parasite works there as well. Ooh, and before I do that, so this was my quiz question. Before I do that, I'd like to ask you if you think that adult cows will be able to infect each other directly with Neospora parasite. So we've talked about that vertical transmission of cows infecting calves in utero, but do you think that adult cows are able to infect each other directly? So if I would put two cows together in a paddock, will they infect each other?
Okay, we've had about 50% in, 60. It is anonymous, so don't worry about getting it wrong. Right, okay, I'll just close it down now. So the answers that we got are for yes, we got 14%, and for no, 86%.
Excellent. Okay, great. So that's definitely what the current science will say. So the current, if you think about the epidemiology of the parasite, it does cross the placenta, but it doesn't really go from cow to cow, right? So it's not infectious like IBR or BVD would be infectious from cow to cow. So that's pretty good answers. What I would challenge though, so I would challenge that answer a little bit, and I can't back that up with science, but if you think about if cows calve, you would have multiple cows calving in a small calving paddock together. I would have seen cows eating each other's placenta after one of them has given birth, right? So if you then think about that, the majority of those parasites, so the tachyzoid stage, which is a certain stage of the parasite that sits in that placenta, and that's how it infects the calf, there's thousands of those parasites in that placenta when that cow calves. I'd argue if another cow would eat that placenta like a dog could eat that placenta, there might be a small chance that that cow could get infected. Dogs definitely get infected when they eat that placenta, and they sort of try to show it for cows, and they haven't been able to prove it yet. But I sometimes think if you think about how the parasite works and how it behaves, I wouldn't really exclude that risk. And that sort of takes me to the next slide, where I was going to talk about how we can prevent horizontal transmission, right? So now we're really getting to the, okay, so what can we do about this disease, and what kind of things with regards to biosecurity do we need to think about? Now, I'm talking about horizontal transmission first, because I would argue if you can't do anything about horizontal transmission, right? So this is dogs, foxes being able to transmit it to cows. If you can't do anything about that, then I think it's sort of challenging to then go and do something about vertical transmissions, which we'll talk about in a second. And you also have to consider that you can't completely control the situation, right? I know that you can't make transmission completely impossible, but it's all about reducing the risk of dogs having access to farms and all those type of things. So think about horizontal transmission first, and then think about vertical transmission, and that's why the slides are in this order. So dead fetuses, dead animals, uterine discharge, placentas should be disposed of so that dogs and foxes can't get access to it, right? And on farmer meetings, I've discussed a variety of ways that people do this. It is definitely possible. It is a hassle, I know it is, but it is really worth thinking about, because if there's nothing for that wildlife to come to your farm for, if you can make that as least attractive as possible, that would really help for Neospora as well. Dogs shouldn't have access to calving areas or recently calved animals, right? So the idea is to really try to prevent canids from actually being able to access to digest or to take in the parasite, right? That's what you're trying to prevent. You can try to do what the clever dog is doing on the side, but that might be a bit tricky. But I'm hoping that you can try to do something with regards to removing placentas as soon as possible and trying to keep dogs out of calving areas. If you are a pasture-based herd, hey, I used to work in New Zealand, that's far more challenging, and I know it's not an easy solution, but if you would calve your cows inside, I sometimes think there's definitely improvement possible on some of the farms that I've been on. Preventing access of dogs, especially puppies, to silage pits, hay sheds, feed areas, and concentrate feed stores. And that needs a little bit of context. So if dogs don't get access to feed areas, they won't be able to poo there. If they're not able to poo there, then cows won't get, and that cows don't get access to poo, then they won't get infected, right? So even if your dog is infected, if he doesn't poo in areas where cows have access to, then you might be okay as well, right? I've written there especially pups, because what also a key bit is that you need to know about is that if a dog gets infected with Neospora, it will probably shed these parasites, oocysts, around 2 or 3 weeks after they've been infected with them, after they've been eating some placenta, that sort of thing. They will shed the parasite for around 7 days, 10 days or so. After that, they're very unlikely to ever shed again, right? So that means that your farm dog, if that farm dog has been infected a couple of years ago because it's always been eating placentas, it's very unlikely that that dog currently is a risk on your farm, right? Because it's already built up immunity. It is very unlikely to reshed. Very unlikely are my words, because it's not impossible. So if that dog would be immune suppressed or be really ill, then it might actually start reshedding again. So not impossible, but far less likely. So to get back to that bit there at the bottom, don't shoot the dog. Hey, that's what we used to think in the past about Neospora. Get rid of the dogs on farm and then you'll sort your Neospora problem out. Well, you won't. And sometimes it's even counterproductive. So what some people have done in the past is that, oh, I'll get rid of the dog because it's Neospora positive and I'll get a new puppy in. But actually, if that puppy is naive and starts eating infected material, that pup is likely going to start shedding it again. So you're actually almost increasing your risk. So you're much better off holding on to the dog that you already have that probably has been infected already in the past. In addition to that, there's some research that shows that there's actually a preventive effect of having dogs on the farm, particularly because you can sort of see them as guard dogs, and they would try to keep other wildlife, foxes, and if you're in Canada, for example, coyotes, away from the farm, and they would therefore reduce your risk of more Neospora on the farm. So dogs are not necessarily a bad thing, but they shouldn't get access to infected material, and they shouldn't be able to poo in areas that cows can consequently have access to. Soiling of pasture should be avoided. That's easy to say. There's definitely a few farmers now putting up signs out on paddocks that would indicate that the cows carry a disease that may affect dogs for the dog walkers out there, or the other way around, that their dogs might carry a disease that could affect the cows, and ask people to pick up poo and all that sort of stuff. And that's definitely a good thing. And then there's the birds, rodents, and wild animals that you try to keep away from feed areas in particular. So you can think about birds, and again, think about trying to do something about it is not that straightforward, but trying to close off feed areas, trying to put plastic back over silage clamps and all that sort of thing is really worth it. Because think about it, if those animals, if that wildlife is infected with Neospora and dogs go and eat those that wildlife as cadaver material, then that might get them infected. And there's lots of other diseases for which it would be good to keep good, like rodent control, up to date. Raw meat to dogs, ideally you shouldn't be feeding raw meat to dogs, right? And again, think about this. Natural infection of Neospora has been shown sheep, goat, deer, but obviously also calf cadaver material. Now, it wouldn't be, I think in my experience, unusual that that cadaver material would go to hunt kennels. And hunt kennels or the dogs from hunt kennels wouldn't be unlikely to go on farm fields. Now, you can imagine that there's a life cycle there for Neospora to flourish, because if they would eat that meat that's infected with Neospora, and they would then pass those oocysts onto pasture where cows would have access to them, or they would poo somewhere in an area where there's feed and that would go into the TMR, that will be a risk as well. And particularly if there's a big turnover in dogs, where naive dogs would come in that would eat that raw meat, that's definitely a risk to consider. And then that last item there, advisable to calve no Neospora positive animals in isolation from negatives, that relates to that question that I've just asked with regards to if you think that cows infect each other. So currently, there's no evidence to show that that occurs. But if you sort of think about the parasite and how it works, if I would be a farmer and I would know my Neospora positive and negative animals, I would calve them separately if I would have the opportunity. Right, so that relates to horizontal transmission. I'm looking at the clock as well, and I think we really need to move on to the next slide. And that is all about vertical transmission. So what that really is about is trying to prevent Neospora going from the dam to the calf in utero, right? Now, yeah, you can go and test all your animals and you can cull all your seropositives. That's a way to deal with it. But imagine what I said at the start, or remember, sorry, what I said at the start, is if you cull all your seropositives, but you don't do anything about the horizontal transmission, the risk of getting it back onto the farm are significant. So that's not always a solution, or it's not a solution on its own, I would say. Often also, if you start testing animals, there's relatively high prevalence. I think 70% of the bulk milk samples in the UK shown up positive for Neospora. So we know we've got plenty around. It's an endemic disease. So sometimes within the herd, your prevalence, hey, the number of positive animals is that high that you can't just say, oh, I'll just cull all those animals. That's really not an option. So what we would then say is breed them to beef, don't keep the offspring. And for a beef herd, it would be the same. Don't keep the offspring of Neospora positive cattle. Because of the vertical transmission, it's quite likely that the offspring will be positive. But think about it again, that vertical transmission sits somewhere between 30 and 100%. So thinking about this last point on the list, and I might move there first because that's important, thinking about trying to improve the immunity of the animals in your herd is crucial for a variety of reasons, but there's some really nice research that shows that if you have Neospora in your herd, and you do have BVD and lepto in your herd as well, then your cows are more likely to abort because of Neospora. While if you would have Neospora in your herd, but you're free of BVD and lepto, you're less likely to abort because of Neospora, because not every cow that has Neospora will always abort, as you can remember from that life cycle that I showed at the start. Right? So trying to do something around immunity. Hey, if you say, oh, I've tried all my horizontal control measures, I've tried all my vertical control measures, what else can I do? Well, actually becoming BVD free, controlling lepto or some other endemic diseases that we have in the UK will also help reduce the clinical effect, so the abortions that you get because of Neospora. Bulls we can sort of forget about, so semen bulls is not really important in the Neospora epidemiology, so we don't really worry about that. If you would have a valuable animal that's Neospora positive and you would really like offspring for her, you can use embryo transfer because the parasite doesn't transmit in those first 7 days, right? So that's an option if you would have valuable Neospora positive animals. And then to prevent vertical transmission within a herd, obviously, if you're going to buy animals in, buy seronegative animals in. ELISA, that's the most commonly used test for Neospora, is actually pretty good. So no test is perfect, but your Neospora ELISA is pretty good. So if it is positive, that animal is likely to be positive. If the test turns out negative, it's likely that the animal truly is negative. However, I've put with that there, assess the herd status, because I'd always go and ask if their checks accredited or if there's some information more about the herd instead of just the individual animal level of what you of the animal that you're trying to buy, because knowing that the whole herd has been free of Neospora for the past 10 years and they've been monitoring it, that would give me much more confidence knowing that I'm truly buying in a negative animal. Right, so that's about the vertical transmission. I'm going to move on. And there's a quick question there just to see if everyone's still awake. So if I just briefly mentioned the cattle health certification standards. So my question is, which diseases are included in these standards? So checks, a regulatory body for cattle health schemes in the UK and Ireland, that's set up to control and eradicate non-statutory diseases. And I've listed IBR, BVD, Neospora and Youngish disease. And I guess my question to you is, which of these diseases are part of the cattle health standards or the cattle health schemes?
Okay, just waiting for a few more results to come in. Just had a quick question, if that's okay, whilst people are answering. Does it cause any health problems to dogs or bitches if they have if they're infected with parasites?
Yeah.
Just wondering if it's another angle to,
Yeah.
try to reach dog owners.
Yeah, definitely. Yeah, definitely. So there is a risk of clinical disease, definitely, because of Neospora. So we would talk about neosporosis in dogs the way we talk about neosporosis in cows. However, dogs don't necessarily abort. They do pass Neospora on to their offspring. And what you do see in dogs is neurological disease. So they would sometimes have hind limb paralysis, so their back legs are off. That doesn't happen in every dog that we infect with Neospora, if we would do that on purpose, but it's definitely described in clinical practice. And the difference is, so it's a good question, because the difference is lots of times when we see dogs with clinical neosporosis in practice, we can actually treat those animals with doxycycline, and that is because those animals come into the practice when they're still in the acute stage of Neospora. So often people ask me, well, why, if we can treat dogs, why can't we treat cows? Well, in cows the stage of the parasite is different, and therefore we can't really treat it. In dogs, if you bring them in early enough, you may be able to treat it. Sometimes those dogs will become permanently infected, and sometimes those dogs will be happy throughout their life, but if we would go and test them, they would be positive for Neospora. I hope that answered that question. Do you have some results, Kate? Maybe not. If not, because I can't see the answers on my screen and I can see my watch, what I might do otherwise, if Kate is not going to interrupt me, I'm just going to move on to the next slide. So what I wanted to do briefly is just step back to that first slide that I started off with, where I said, oh yeah, there's lots of things you can do with regards to biosecurity and trying to improve biosecurity in your herd, but you sort of need to know what you're going for and what you're trying to achieve. Because if we would think about Neospora, yeah, closed herd is important, herd health plans, check schemes is important. Boundaries, for example, are actually not that important unless you think about boundaries trying to keep dogs out or foxes. Quarantine is sort of a special case as well, where you need to know a little bit about the diseases that you're trying to control. Because if you think about Neospora, that cow is actually only at risk when she's aborting or when she's calving, right? So when a Neospora positive cow is not pregnant, there's actually not a chance that she's going to transmit that to anyone else. So quarantining an animal that you buy in for the first 3 weeks is useful for lots of other diseases, but not so much for Neospora. Then there's things around replacement, young stock rearing. Hey, because if we do that really well, then we don't need to buy animals in. That's not that relevant for Neospora right now. Embryo transfer I've discussed. And then there's these things at the bottom around vaccination, using disinfectants, food dips, and slurry, which you sort of can put by the wayside for Neospora, because those are not really options that we have in our cows. And I mentioned something around treating dogs, but with cows that is not really possible at the moment. I can talk about vaccines, but we haven't really got enough time for that. But again, there's no vaccine currently available, and it's going to be a while, I think, before there's something effective on the market. However, public access wildlife, yeah, that is definitely something that we can try to do something about. And that's not only useful for Neospora, but that's useful for some of the other diseases as well. So what I'd like to do in the last 5 minutes is just relate, I guess, those biosecurity measures to some other diseases that are also endemic diseases in the UK. So IBR, for example, right? And again, it's more to emphasize that, yeah, a closed herd, non-negotiable, right? If you're IBR free, the biggest risk of getting it onto your farm is by buying an animal in. So knowing what you're buying is incredibly important, and being part of cattle health schemes yourself, so you can show to other people the status of the diseases that you're trying to control, but also when you're buying in animals, really important. For IBR in particular, it's also really useful. So there's lots of vaccines available for IBR. Yes, they're pretty good in reducing clinical signs of disease. But what you need to keep in the back of your mind is that IBR is a virus that creates a carrier status inside the animal. So once I infect an animal with IBR, it will keep on carrying that virus for the rest of its life, and it will sometimes start shedding that virus. And that's irrespective if you would vaccinate that animal after it's been infected with IBR. It will reduce clinical signs if that virus would rear its head again during times of stress, for example. So vaccination is useful, but it doesn't really eradicate disease. And there's a few links there on things that AHDB have got on their website and in various places that talk about vaccination in a bit more detail. And I can't fit that in right now, but that's about generic vaccination as well. And it's got some useful, hopefully useful best practice guidelines in there that are useful to think about for IBR, but also for some of the other diseases that we can vaccinate against. So that's relating to IBR. Very briefly for BVD, because if you want to find stuff out about BVD, the BVD free website is really good with lots of information. It's a brilliant initiative trying to control BVD. There's European countries that have eradicated BVD, so they've shown that's possible with or without vaccination. Depends a bit on the type of scheme that you're running. And I've just put on that picture, the picture from Twitter here from Professor Brownlee, and he's carrying this massive carrot. So that's what he brought on stage during the BCVA Congress last year, and the discussion was really around how big does a carrot need to be, so we can really try to engage people in the disease control process. But perhaps if we're really confident about trying to eradicate or wanting to eradicate the disease as an industry, we might also sometimes need a stick. And there's some good information out there from different countries that have controlled BVD that we can learn from, I think. But yeah, if you want to know more about BVD, that website is a really good place to go to. And then my last disease that I wanted to spend a little bit of time on is Youngish disease. Again, important disease. There's a great national Youngish management plan out there. So there's the Action Youngish website that can help you finding out what the risks are, finding out your disease status, coming up with a management plan. Lots of vets being trained in the area to help you manage that disease. So I'm not going to go through the whole epidemiology like what I've done for Neospora, because everyone will be asleep by the end of that probably if I keep going. But I think, again, the key message that I wanted to get out here, again, if you are Youngish disease free, or you think you are Youngish disease free, because that's pretty difficult to confirm, but if you're a low risk herd, the biggest risk is getting animals in or getting contaminated manure in. So again, having that closed herd and rearing enough young stock to make that possible is really something to focus on. And then the other thing that often I get into a discussion to when I talk to people about Youngish is the fact that an individual animal test is not always that useful if I would compare that to knowing the herd history. And I'd argue that's particularly valuable for Youngish disease. So I can think of the story of people buying heifers from Holland, which obviously, I don't know, sometimes people come to me because they sort of want to blame me for that. So they say, oh, well, I've bought 10 heifers in Holland and they were tested Youngish negative, and now I've got them on the farm, and 3 weeks later they start to get ill and skinny and scour, and my vet comes out and tests them, and now the test says that they're Youngish disease positive. So were the people in Holland lying to me, or what was going on, right? And I think to learn from this is that no one's lying, hopefully, but it is the parasite, or not the parasite, it is the bacterium, right? The mycobacterium that's really clever, I guess, and sort of knows how to evade the test. So the test that we do for Youngish disease is looking for antibodies most of the time. So it looks for the immune response of the animal towards the disease. Now, if an animal is healthy but is subclinically carrying Youngish bacteria, the immune system doesn't really recognize them if those bacteria are nicely hidden away somewhere in the body of that cow. So if I test those animals and I'm trying to measure antibodies, if the animal hasn't really triggered a good immune response, it's going to turn up negative. So that's what may have happened with those heifers that were tested before they were shipped over to the UK. If I then put that animal under stress because of transport or whatever, that bacteria thinks, this is a nice moment to go and spread around the body of that cow and cause some havoc. That triggers an immune response, and therefore antibody levels go up. So if I then test that cow again, then she suddenly turns up positive. So point being of this whole story is that testing an individual animal is sometimes worthwhile, but often you would have to do that repeatedly. So that's what we're doing with the herd-wise programs. If you do it repeatedly, you increase your chances of actually finding those antibodies in that animal if she's normal and healthy from looking from the outside. If you're buying in animals, then I think the key message is really try to get a herd history, try to get information from the herd that you're buying from, because that is really more valuable than testing that individual animal that you want to buy. And I will leave it at that. So just one more question, and then I've got 2 slides to wrap up. So this was the question that that we showed you the answers for right at the start. So that's more out of interest. So which of the diseases of the ones that I've discussed, so IBR, BVD, Neospora, and Youngish disease, which of those to you is the most important?
Yeah, and the answers that we got before for that was Neospora was top at 60%, BVD and Johne is about equal, just behind, and then IBR was the lowest on that.
Yeah, okay, good. Thank you for reminding me of that. Okay, so that's good, because hopefully then some of the things that we've discussed around Neospora were useful were a good use of your time, is what I'm hoping, trying to finish up. I'll move to the second to last slide. So just trying to wrap up, I guess key messages is really prevention always better than cure. And it sounds a bit boring maybe, but it is worthwhile, and that's really what biosecurity is about. So what to look for when you buy animals, I'd say herd history, really important. Herd health status, try to get information of that. So try to ask the person you buy from for that information, or ask their permission to talk to their vet about it, and they might be able to give you that information, right? And you can only ask, they might not give it to you, but if you don't ask, you definitely don't have it. What can you do preventatively? Well, I'm hoping that some of these things that we discussed, sort of, or that I presented, sort of show that it's a relatively complex situation. So it depends a little bit of the situation that you're in and the things that you're trying to control. So it's really something to talk to your vet about, to get some training maybe in certain areas. Sometimes it's useful to vaccinate, but sometimes that doesn't make that much of a difference. It depends on the situation that you're in. And I guess that last bullet point is biosecurity is all about reducing risk. So it is, what you're trying to do is you're trying to manage risk. You can't eliminate risk, right? It's not a poultry or a pig farm, not that there's no risk there, but it's a completely different situation that you're trying to control with regards to biosecurity measures. So that's much more I guess on a cattle farm, be it beef or dairy, it's far more challenging. But I don't think there's no opportunities. I think there's plenty of opportunities of trying to improve the situation that we currently have. And then that last link is there just as one of the practical things. So if we talk about vaccination, sometimes it's really simple things. So doing the right thing at the right time in the right place. And some of the recent research that one of my undergraduate students has done showed that you need to inject in the right place to be able to prevent some damage that you might do to a sciatic nerve when you are vaccinating or injecting animals. So that's what that video relates to, and that's what these pictures relate to as well, because using needles multiple times, again, from a biosecurity point of view, is not great. So if you look at that electron image after 6 uses of a needle, that's what the tip of the needle looks like. Well, you can imagine that it's quite easy for bacteria to harbor in there, cause an abscess, and then what you would get in your meat is some of these pictures that you see over there. I won't leave those too long on the screen because that's not too good if you still need to have dinner, but there's some opportunities there for other things to look at. That's me. I would like to thank the Dairy Herd Health Group and all my colleagues in the Dairy Herd Health Group here at Nottingham for learning from them and working with them. And then there's a couple of people on the slide here. So it's Liz Cresswell with the cute calf, and Imogen Richand, who was my PhD student, Marnie Brennan, who's a colleague of mine who knows lots about biosecurity, and Rachel Lowton and Jordan Smith and Rosanna Kirkwood, who are all three of them were undergraduate students who've helped me out with some of the research that I've presented bits and pieces on here as well. And that is it for me. Visit the AHDB website. So there's lots of really relevant stuff if you want to learn more about it. And would like to thank you for your attention, and happy to hear any comments or answer any questions.
That's brilliant, thank you. So yeah, we have got time for questions now. So if people want to type anything in, then they'll be able to answer them now. Just whilst we're waiting for any to be sent through, just a quick reminder that the webinar this evening has been recorded, and it will be on the AHDB Dairy YouTube channel, along with all the other webinars that we do from the past few years. Also, the supporting resources and links are all available on the original email invitation that was sent out. So things including links to BVD free, our biosecurity information, cattle purchase checklist that we've got, buildings biosecurity, and then also the Action Youngish website as well, which could all be helpful following on from this. So I'm just having a quick look now at the questions, won't be a second. Right, okie doke. Right, any evidence that badgers transmit Neospora?
The only evidence I think there currently is that they have found Neospora in badgers. They haven't been shown to actually transmit it. So there's no evidence that if a dog would eat a badger that would get the dog infected, but circumstantial evidence would point in that direction. There's definitely antibodies against Neospora shown in badgers. So I wouldn't say that they're a big risk factor, because people have been looking at a whole variety of wildlife, and currently it more points towards chickens, for example, and pigeons. If they look at how the parasite behaves in those birds, that appears to be more of a risk factor compared to badgers, as far as I know.
Okay. All right, brilliant. We haven't had any more questions in, probably because we did the detail on Neospora, and that was everybody's kind of main cause for concern. Hang on a second. Right, there's just another one that's come through, and that next one's from Hazel as well. And Hazel asks, should we try to stop cows eating the placenta after birth? After they've given birth, should we try to stop the cows eating the placenta?
Yeah, so I would think, so for a cow to eat her own placenta doesn't matter anymore, if I think about it, because that cow is infected and she will have transmitted that to her calf if it's in the placenta, most likely. But that cow is already infected anyway. So once a cow is infected, she remains infected for life. So if she would then eat more of the parasite, I don't think that's a risk. So the only risk that I think there is when an infected placenta would be eaten by a cow that is still Neospora negative. That's where I think the risk sits. But I have to admit, the evidence for that currently doesn't exist. It's just, if you think about the parasite, I think, if it can go via dogs, and if it's pretty clever, like that tachyzoid stage is quite a fast moving effective stage. So I would think, if you give enough of that to a cow, that potentially might be slightly immunosuppressed because of the stage where she's in. I don't know. I would love to. No, I shouldn't say I would love to do the experiment, but I think it's really important that we would identify that for sure. But those type of things in experimental settings are really difficult to do. So from a practical perspective, cows eating their own placenta, I don't think that's a problem. Seronegative cows known to be Neospora negative, being able to eat placenta from a cow that's seropositive, I would avoid that if I can.
Okay. Great. Right. Another question in from Martin. By not culling Neospora positive cows, does this increase the chance of spreading to the rest of the cows in the herd? Is there a lot more chance of the placenta being eaten by, say, a local dog?
Yeah, that's a good question. So yes, so the more Neospora positive animals you have, the more risk there is that you're not going to be there when that cow calves and when she leaves her placenta somewhere, or when that cow, hey, there's also, if you're Neospora positive, 5 times more likely to abort compared to a seronegative animal. So there is a bigger risk. So that could be a reason to try to reduce the number of seropositive animals in your herd, definitely. I'd argue, though, again, that's very much comes down to how you manage your herd. So if you can manage your herd with all your cows calving inside, and you think actually the chances of that placenta being accessible to dogs is quite minimal because I've got them inside and I know what I'm doing and dogs can't get access to that, then it's less of a risk to have a seropositive animal on your farm. If you're pasture-based, it's a slightly different story because it's far more difficult, I'd argue, to manage.
Okay. Right. Okay, we haven't had any more questions come through, so hopefully that's just kind of tidied things up if people had anything that they'd like to ask. If there was anything from this evening, perhaps people weren't able to ask what they wanted, or something comes up, then please let us know, and it's something that we could provide some information on. So we'll wrap up. Wendela, thanks very much for your time. Really appreciate all of your expertise, and thank you for such an informative webinar. Like I say, it's going to be available on YouTube if you wanted to go back and take a look at any of the information, and keep your eyes peeled for future events and webinars that we've got coming up. And so we'll end it there for tonight. So thanks, Wendela. Anything else that you wanted to just leave us with?
Nothing specific. Thanks very much for organising, and thanks everyone for listening. And yeah, I hope we can. I hope this has helped a little bit to try to improve biosecurity, and happy to answer any other questions if questions come up after the webinar.
Okay, perfect. Thank you very much. Good night, everyone.
Okay, cheers.